I am Bernard Herschel. Before my retirement, I was the chief of HIV/AIDS at the Geneva University Hospital. You might call me an AIDS dinosaur who has followed the HIV epidemic from the very first cases in the early 1980s through the triumph of antiretroviral therapies unequaled in the annals of medicine. Of course, this triumph has its flip side. Younger colleagues are no longer familiar with the opportunistic diseases and their myriad manifestations. Hence, the idea of these videos. After a short introduction, they will feature a series of images illustrating one or several exemplary cases from my files. You have probably seen a version of this graph before. After infection of time 0, nothing happens for a few weeks. Then HIV starts to proliferate and disseminate. During that period of intense viral proliferation, the acute retroviral syndrome, also called acute HIV syndrome, may appear. The immune response sets in, viremia falls by several logs, CD4 cells rebound, and the disease enters clinical latency. The period from infection to immune response and disappearance of the acute HIV syndrome is called primary HIV infection, or PHI. The HIV RNA, the P24 antigen, and the different types of antibodies appear in a characteristic sequence called Fiebig stages after Eberhard Fieber's paper in AIDS volume 17, page 1871, 2003. The first test to turn positive is the HIV RNA, followed by P24 antigen, IgM and IgG antibodies, and finally the bands in the Western blot. If a patient is in Fiebig stage 1, only the RNA is positive. In stage 6, everything is positive. Let's look at the time sequence of primary HIV infection, PHI, in more detail. On this graph, the red line denotes HIV RNA levels, which become detectable at 10 to 100 copy numbers. The x-axis shows time in days following HIV transmission. Note the gradual appearance of markers of HIV infection corresponding to Fiebig stages 1 to 5, and the appearance and disappearance of the acute retroviral syndrome. In the medical literature, one can find different definitions of a quote-unquote window or incubation period. From infection to detectable HIV RNA in the plasma, Eclipse. From infection to positive screening tests, this corresponds to the traditional definition of an incubation period. It is the time elapsed between infection and the appearance of symptoms. And finally, window, the time elapsed between first appearance of HIV RNA and positivity of screening tests. Note that only the window is well defined, see next slide, whereas there is a big question mark about the time between infection and first detectable HIV RNA, to which we'll come back. Nucleic acid tests which detect HIV RNA are not adapted to large-scale screening because of expense and false positive results. Screening tests detect the immune response and have improved over the years. First-generation tests detected only IgG using antigens from culture supernatants. The fourth-generation tests used today detect IgG and or P24. First-generation tests became positive on the average about 4 weeks after HIV RNA appeared in the serum. With fourth-generation tests, this delay is cut to approximately 5 days. Note, however, that none of these tests detect Fiebig stage 1 when only HIV RNA is present. Back to the big question mark. How many days between infection and the first traces of HIV to be detected? Most patients who present with acute retroviral syndrome do so within 4 weeks after the suspected date of HIV transmission. However, for a more precise estimate, one needs to analyze a large number of events where the date of transmission can be determined unambiguously. For instance, transmission by blood transfusions, needle stick exposure, or a unique sexual exposure. In a majority of patients, the Eclipse period lasts 7 to 21 days. There are, however, persons with a longer Eclipse period. Estimates for the 99th percentile, when 99% of infected people have a positive fourth-generation screening test, vary. A commonly admitted value is 3 months after the date of transmission. In other words, a negative screening test 3 to 6 months after a suspected contact lowers the risk of transmission by about 2 logs or 100-fold. Patient 1 is a 37-year-old woman who on May 5th, 2020 had sex with an African man. On May 20th, she falls ill with nausea, fever, anorexia and pharyngitis. Worried about HIV infection, she tests herself. The test is negative. On May 23rd, 2020, she repeats the test, which is again negative. However, she doesn't believe the result and insists on a fourth-generation laboratory test. Note that on May 23rd, the rapid test is still negative, as is the third-generation lab test. However, the fourth-generation lab test is positive and the viremia is very elevated. This is a logical result because the rapid test and the third-generation test rely on antibodies to HIV. But the acute retroviral syndrome occurs precisely because there are no antibodies yet, which explains the symptoms and the very high viremia. By the way, the package insert for the rapid test very clearly notes that it is not sensitive for the detection of acute retroviral syndrome. A 42-year-old businessman drinks too much at a party. The next morning he wakes up in company of a woman who asks him for money. He visits you the next day, convinced that he caught the HIV. Can you reassure him? You may pause the video while you think about the answer. Well, we are some 36 hours after a sexual exposure, and at that time there is no informative lab test to exclude HIV infection. However, many people in this situation overestimate the risk. Consider that HIV infection in European prostitutes is much less than 1%, and that the risk of transmission after a single sexual contact is also less than 1%. Though the cumulative risk for this patient is the multiplication of these two probabilities, and we arrive at a risk of transmission which is less, probably much less, than 1 in 10,000. This may be reassuring for this patient. Conclusion. There is no laboratory test which can reliably detect infection in the days after exposure, the so-called Eclipse period, which in general lasts 1 to 3 weeks, but can be longer. Symptoms of the acute retroviral syndrome, ARS, correlate with extremely high levels of viremia, which are a consequence of the absence of antibodies to HIV. Screening tests, especially do-it-yourself autotests, rely on antibodies. Therefore, they do not perform well to detect HIV during ARS. Modern laboratory tests detect P24 and antibodies and can be used to diagnose the ARS. They turn positive within a few days after appearance of HIV RNA. Thank you for watching. I'd be grateful for any feedback. A companion video is available in this chain with case studies illustrating the acute retroviral syndrome ARS. If you are interested in other videos about opportunistic diseases in AIDS, please subscribe.